Hey guys, in this lesson we are going to very briefly talk about how to calculate pediatric medication dosages, and then what we're going to focus on is some scenarios for you to practice with. What we're going to cover here is we're going to look at how to calculate the doses. We're going to talk about some basic rules that you need to follow, and then we'll jump into these scenarios. All right, so the main thing that you need to remember when giving any medication to a child is that we always have to take into account the age and the size of the child. Now, sometimes drug books that you will use may actually give doses based on age, but the safest and most common way to account for age and size is to use milligrams per kilogram, so weight-based dosing, or body surface area. Body surface area is actually the most accurate way to calculate dosing, but it's not used as commonly, so we're not going to focus on that in this session. Body surface area is used for things like chemotherapy, things that need to be very, very, very extremely specific, but it's not something that you'll use on a day-to-day basis. But the weight-based dosing, like milligrams per kilogram, is something that you will use on a daily basis. Now, it's not always going to be milligrams. Sometimes you'll see it prescribed as units or even grams, depending on what the medication may be. But it's always going to be that unit, that gram, or that milligram multiplied or per kilogram that you're giving it. Now, for a lot of medications, you're going to see a range given for what is safe. So what a drug guide may show is something like 10 to 15 milligrams per kilogram per dose. And that would be what's called your safe range or your safe dose range. So anything that you calculate that's between that 10 to 15 milligrams per kilogram per dose for that particular medication would be considered safe. Another variable that we need to consider for children that doesn't come up as often with adults is giving medications in suspensions and liquids. And what this means practically is that there's an extra calculation that has to be done to figure out how many milliliters should be given in order to give the correct dosage in milligrams. Now, all these variables added together, what that means is that we have an increased risk for medication errors when giving medications to kids. So just make sure that you're always double checking your math and that you get help if you aren't sure. All right, so let's get started with our scenarios. So while we're going through these practice problems, just pause the video, work through the question yourself, and then when you have an answer, restart the video and I'll walk you through the calculation. All right, our first practice problem here, we have a 1-month-old baby named Anna who's been admitted to hospital with a high fever, lethargy, and poor feeding. A full septic workup has been done, so she's had a lumbar puncture that's been cultured, she's had a blood culture, and they're doing a urine culture as well. While waiting for these test results, the baby will be admitted and given IV antibiotics. She's been prescribed ceftriaxone, or Rocephin you might see, and ampicillin. So we're going to end up calculating safe dose ranges for Anna for those two medications. But the first thing we need to do is actually find out what her weight is in kilograms. So it's important to note that when we're doing weight-based dosing, we are always going to use kilograms. Okay, we're not going to calculate it using pounds. So we need to take a second and calculate what her weight is in kilograms. So the formula for this is to know that 1 kilogram is equal to 2.2 pounds. So just take a second and go ahead and calculate her weight in kilograms. Okay, so let's go ahead and calculate this. So the tricky thing to remember with this particular case that we have here is that we have to work out 4 ounces and figure out how much of a pound of 4 ounces is. So remember, there are 16 ounces in a pound, so 4 ounces equals 0.25 of a pound. Okay, so when we're thinking about calculating this, we're going to be working from 8.25 pounds. And all we have to do here to figure out how many kilograms 8.25 pounds is divide the number of pounds by 2.2. And when we do that, we're going to get 3.75. And that's how many kilograms Anna weighs. So an easy thing to remember is that kilograms is always going to be less than pounds. So you're always going to be dividing the pounds by the 2.2 to get the number of kilograms that a patient is. All right, so the next thing that we're going to do for baby Anna is that we're going to calculate safe doses for both ceftriaxone and ampicillin. So we've already done the first and most important thing here, and we've converted her pounds to kilograms, and so we know that baby Anna weighs 3.75 kilograms. So you look in your drug guide, and you see that the safe dose for ceftriaxone is 100 milligrams per kilogram per day, given once daily or every 12 hours. So go ahead and take a couple of seconds to calculate that. Okay, so here we want to take 100 milligrams and we're going to multiply that by her weight, which is that 3.75 kilograms. And that gives us an easy 375 kilograms per day. So if she's prescribed once daily dosing, then we're going to give that 375 kilograms once a day. If she's prescribed BID dosing, then we're just going to take that 375 divided by 2, and we would calculate 187.5 kilograms, which we're going to round up to 188 kilograms for our BID dosing. Okay, so moving on, we're going to calculate our safe dose range for ampicillin. Now, remember, I mentioned that some medications will give you a range for what is safe. For ampicillin, the safe dose range is 25 to 200 milligrams per kilogram per day, given every 6 hours. So just remember to pay attention to why we're giving the medication. If it's a more severe infection, it may be appropriate to give 200 milligrams per kilogram. If it's a less severe infection, you might give a lower dose. So just always know why we're giving a med. So what we're going to do here is we're going to have a couple of calculations that we need to do. So the first thing we need to do is calculate how many milligrams we would give if we were giving the lower dose. So 25 milligrams times 3.75, which is our patient's weight. And then that is going to give us 93.75 milligrams, which rounds up to 94. So she could have 94 milligrams per day as the low range of the dose. Now, moving up to the higher range, so we're going to calculate 200 milligrams times 3.75. For the higher end of the dose, she could have 750 milligrams per day. Okay, so the next step here is to realize that Anna needs to get this medication 6 hours a day. So she is going to have 4 doses given in a 24-hour period. So to calculate this, we then need to divide these two totals by 4. So we're going to divide 94 by 4, and we're going to divide 750 by 4. And that's going to give us the amount of medication that she can have per dose. So for the lower end, when we're dividing 94 by 4, that gives us about 24 milligrams per dose. And then for the 750 milligrams per day, when we divide that by 4, we're going to get 188 milligrams. And again, that is per dose. So we had to do an extra step there to calculate how much she can have per dose because the formula that we were given by the drug book gave us how much she could have per day. So just always make sure that you're paying attention to whether your formula is per day or per dose so that you can really get the accurate amount that she can have. Okay, so let's move on to our second scenario. We're going to be looking at a 10-year-old boy called Jacob. He weighs 35 kilograms. So we've already got our weight in kilograms. We don't have to do any conversions there. He's come into the ER with a wheeze. He's a known asthmatic and he's already been started on nebulized albuterol. And now he needs to start an oral steroid that's called prednisolone, or sometimes you may see it called Orapred. So let's calculate how much prednisolone Jacob can have. You go ahead and look in your drug book and you see that he can have 1 to 2 milligrams per kilogram per day. He can have it as once daily doses or divided into 2 doses per day, spread out 12 hours apart. All right, again, so we are calculating a range here. So we're going to multiply 1 times the patient's weight. So our lower range of medication is he can have 35 milligrams. And then on the upper end, we're going to multiply by 2, and we're going to get that he could have 70 milligrams. So Jacob can have anywhere between 35 and 75 milligrams in a day, in a 24-hour period. That is his safe dose range there. If you're going to calculate how many he can have, if you're giving it BID, you would just divide the dose by 2, and that's going to give you your safe range for Jacob. Okay, and our last scenario here, scenario number 3, we've got a 5-year-old girl named Carla. She has pyelonephritis. She's already been started on antibiotics, but she's still fevering. So her mom requests some acetaminophen to bring the fever down and to help with pain. Carla weighs 15 kilograms, so again, we don't have to do any conversions there, and she's been prescribed 225 milligrams of acetaminophen every 6 hours, PRN, pain, and fever. So I want you to calculate if this is a safe dose for her. In your drug book, you see that your safe dose for acetaminophen is 10 to 15 milligrams per kilogram per dose. Okay, so when we're calculating our safe range here, we're going to start with our 10 milligrams per our 10 milligrams. Our 10 milligrams. So we're going to multiply 10 times the patient's weight, which is 15 kilograms. And then we're going to multiply 15 times the patient's weight to get our upper end of the range. So for our lower end of the range, 10 times 15 kilograms, you get 150 milligrams per dose that she can have. And for our upper end of the safe range, 15 times 15, you're going to get 225 milligrams per dose. Now, again, this is the safe range we have is by dose, so we don't have to do any more steps to calculate how much she can have. That's how much she can have per dose. It's not written per day, so you don't have to divide it by the number of times she's going to have it that day. So just to clarify, our safe dose range for Carla for acetaminophen is anywhere between 150 milligrams and 225 milligrams per dose. Okay, our next step for scenario 3 when we're taking care of Carla is we have to calculate an actual amount of medication that we're going to give. So the pharmacy provides us an acetaminophen in an oral suspension that is 160 milligrams per 5 mLs. So in every 5 mLs of the medication, there are 160 milligrams. So this is that extra step I mentioned earlier on. We need to calculate how many milliliters we need to give for her to get the 225 milligram dosing. Now, there are a lot of different ways to calculate this. You'll see different formulas and different strategies and ways that you go about it. As long as you get to the right answer, they're fine. So you need to find what works for you. This is something you'll be doing a lot of in pediatrics. So find what works for you. I'm going to just work it one way so as not to get confusing with lots of different methods. But you'll know what works for you. So make sure that you get confident using that. Okay, so the easiest way for me to do this personally is to set this up and solve for the variable that we don't know. So what we do know is that we have 160 milligrams per every 5 mLs. And I'm going to set that equal to 225 milligrams over X because I don't know how many mLs I need to equal 225 milligrams. And when you set it up this way, all you have to do is cross multiply and then solve for X. So it's really simple and just kind of basic algebra here. So when we do 160 cross multiplying with X, we're going to get 160X and we're going to equal, and then we're going to cross multiply again and multiply 225 milligrams by 5 mLs. And what we get then is 1,125. Now, from this point forward, it's very simple. Again, we're just going to solve for X. So we're going to divide by 160, divide by 160. And what we get there is X equals 7. So we are going to give 7 mLs to make sure that Carla gets the 225 milligrams that she's prescribed. Okay, you guys, I hope you found that helpful. Those scenarios are classic pediatric prescribing. They're something